So Bonnie is 62, and she's got wonderful bone structure and some early volume loss, and that makes her a great candidate for injectable fillers. In particular, we're going to look at using Voluma on Bonnie today. The advantages of Voluma are that you get a large amount of volume replacement, so for areas like the cheek or the lower jawline, deep nasolabial fold, they're excellent. Sometimes in the orbital rim area, we'll use Restylane because it's a little bit thinner and is a little bit more refined, but we'll probably use a combination of materials. So the areas that we're going to be filling are going to be the inferior orbital rim, the anterior cheek, the nasolabial fold region, the labiomental hollow, and the pre-gel sulcus. So Voluma comes in 1 cc syringes, which is what this is, and we've attached this to a 27 gauge cannula. So this would be a cannula injection. The advantages of cannula injections are they're less painful, very rare to bruise. You get a very smooth layering of the product, and it just is really nice for Voluma injections. So the first thing we do for a cannula injection is we take a 25 gauge needle and we make a small pinhole in the skin. We can use some topical anesthesia there, and the cannula is inserted in sort of a middle layer of the tissue, and I can feel the cannula up to about here. And I'm injecting, and I really don't want to see very much of a change as I'm injecting. If I see too much of a change, too much material is going in at one time. It should be happening very subtly. And as you can see from Bonnie, she's a good patient, but it's very well tolerated by patients. And there is lidocaine in the Voluma, so that as it goes in, it will numb the areas. So I've started to fill the orbital rim area. I want to fill the anterior cheek now. For the anterior, which means the front of the midface, I like injecting across the cheek. I typically don't inject parallel to it. Now I want to work a little bit more superficially along the orbital rim. So this is Restylane, which gives a little bit of a softer transition for that particular area. Patients and doctors often ask about what the right depth of injection is. And the answer is really whatever works. I always start a little bit deeper, but I'm also always willing to work all the way up to right under the skin. So it really, it's more a function of being comfortable with all the different planes and techniques for injecting. But now I'm going to inject the labiomental hollow and the pre-gel sulcus region. And as you can see, it's uncomfortable, but it's really not a painful. Is it painful, Bonnie?
It's not even uncomfortable.
Oh, okay, we'll take that. So the areas we did exactly were the orbital rim, both the medial orbital rim and the lateral orbital rim, and that was done with Restylane. the anterior cheek buccal region, nasolabial fold, labiomental hollow, and pre-gel sulcus were done with Voluma. It was all done using a 27 gauge cannula injection technique. How was the whole process, Bonnie?
It was pleasant. I mean, it wasn't at all what I expected. It
Okay. Was it painful?
No, a couple little
Okay.
tricks.
Now, as we're doing the procedures, because these products have lidocaine in, you started getting some funny feelings, right? So your eye felt funny for a little bit, and then your lips went numb, right? So the lips go numb from injection in nasolabial fold. The orbital rim injection will give patients often sort of a funny feeling. They're not really sure how to describe it, but it's from numbness of the nerves around the eye. The advantage of the cannula technique is, as you can see, there's no bruising at all on her face, and she will not develop any bruising. She will get swelling. She'll have about 3 days of significant to noticeable swelling, and then it will resolve very quickly. But there really are no restrictions to what you can do. Any questions about anything?
No,
You did great.
thank you.